Hi, my name is Jawaria Chaudhry, and I'm a clinical pharmacist working in a behavioral health clinic. In this scenario, I'll be describing an ethical dilemma involving the use of pharmacogenomic data to guide medication therapy for a patient with major depressive disorder and ADHD. The patient was recently hospitalized in the psychiatric emergency department after experiencing severe side effects and drug interactions from antidepressant therapy. The hospitalization itself was traumatic. Being surrounded by other patients in crisis triggered anxiety and fear, making the patient more hesitant about future treatment. After stabilization, the psychiatrist recommended pharmacogenomic testing to better personalize the patient's medication plan and minimize adverse effects in the future. The ethical dilemma arises around informed consent and data privacy. Pharmacogenomic testing involves collecting and analyzing a patient's genetic data to predict medication response. While this information can be life-changing for someone with complex medication histories, it also introduces ethical concerns about how genetic information is stored, shared, and potentially used beyond the clinical setting. The patient, already vulnerable after traumatic hospitalization, expresses fear that their genetic data could be accessed by insurance companies or employers, or that it could somehow label them in future care. As their pharmacist, I am caught between two professional imperatives: advocating for evidence-based individualized treatments and safeguarding the patient's right to privacy, autonomy, and emotional safety. My perspective as a pharmacist is that I recognize that data-driven care can improve clinical outcomes, but only when the patient fully understands and consents to how their data will be used. Trauma-informed care reminds us that control and trust are essential components of healing. If the patient feels coerced or uninformed, the testing, even if clinically valuable, could re-traumatize them by replicating past experiences of powerlessness in healthcare. I believe my ethical responsibility is to act as both educator and advocate. My role is not merely to explain the science behind pharmacogenomic testing, but my responsibility involves translating complex data concepts into language that empowers the patient to make an informed decision. This includes clarifying how the data is stored, who can access it, and what protections like HIPAA and GINA, the Genetic Information Non-Discrimination Act, exist to safeguard them. Pharmacogenomic testing collects sensitive data, not just medication metabolism profiles, but also genetic variants that could reveal predispositions to other conditions. This data can be stored in electronic health records or third-party databases, raising concerns about secondary use, consent scope, and data permanence. From an ethical informatics perspective, transparency is key. The data should only be used for its intended purpose, optimizing pharmacotherapy, and patients must retain the right to withdraw consent or request data deletion if they choose. Ethically, the collection of health data must always align with respect for persons, meaning the person's comfort and understanding taking precedence over institutional or research goals. To resolve this dilemma fairly, I would propose a trauma-informed, consent-centered approach. Before proceeding with the test, I would hold a dedicated counseling session to review one, the purpose of the pharmacogenomic test, two, the specific data being collected and stored, three, who will have access to the data and for how long, four, the patient's right to decline or later withdraw the consent. Additionally, I would recommend the clinic adopt a tiered consent model, allowing patients to specify exactly how their genetic testing may be used for direct care only, for anonymized research, etc. This approach both respects autonomy and promotes trust, which are essential ingredients in post-traumatic growth and long-term adherence. This scenario highlights how data ethics and clinical decision-making intersect in mental health care. As pharmacists, we must ensure that technology and data serve the patient, not the other way around. Ethical use of pharmacogenomic data demands not just technical competence, but also empathy, transparency, and respect for personal boundaries. Ultimately, empowering patients through informed consent can itself become a form of healing, transforming fear and uncertainty into agency and growth. Thank you.